you are like most people, then you've probably experienced a pain in your knee from time to time. So how do you know when it's something you should worry about, and what can you do about it? Well, Dr. Brad Tolan is here. He is the primary investigator with the NeoCart trial at the San Antonio Orthopedic Group. Dr. Tolan, it's a pleasure to have you this morning. I mentioned off the top, knee pain, it can be quite common and people will experience it. Sometimes it may ignore it and they may not. You are currently recruiting people for a study. Who are you recruiting and what are you looking for exactly?
This is a FDA-approved study sponsored by Histiogenics, and it's called a NeoCart implant. It's a cartilage replacement.
Yeah.
Cartilage injuries are one of the more common injuries that we see.
Possibly in runners and walkers.
Runners,
and
football players, athletes, weekend warriors. So we see it all the time, and there's never been really a good way to correct some of the damage that can occur because of these injuries.
What are you most excited about with this study in terms of what you are going to learn about the patient and how to treat them?
This is really the next generation of treating cartilage injuries. There's never been a great way to replace that cartilage damage, and if left untreated can develop into degenerative arthritis and eventually even a knee replacement. So what we're trying to do with this study, the NeoCart is a cartilage implant taking your own cells. And so you take your own cartilage cells, and the articular cartilage is what covers the bone. And this is an example of a injury or defect to the cartilage. And so the cartilage doesn't repair itself, and that's been the problem. So over time, this will continue to deteriorate, and that's what turns into arthritis. So the NeoCart implant actually takes your own cells, grows the cells, you come back 6-9 weeks later, and then reimplant the cells, and it forms a more normal type of cartilage.
Okay, obviously a lot you can learn about treatment and long-term care. Who is eligible? Tell us that for people sitting at home saying, do I qualify?
The patients being recruited in this study are between the ages of 18 and 55. There's certain comorbidities medically that you can't have, diabetes, rheumatoid arthritis, but typically most people that have injuries that are otherwise healthy may be candidates. There are some exclusion criteria listed on the NeoCart website if you wanted to look.
Wonderful.
But most patients with these kind of injuries may be eligible for this type of treatment.
Okay, so if you'd like to learn more about your own knee condition, you can text knee, that's a lowercase k, N-E-E 9 to 87888, and there's the information on your screen. Or you can call this number, jot it down quickly, 830-477-0607 to see if you are in fact a candidate for the NeoCart study. Dr. Tolan, thank you so much.
Great.
Good information. We'll be right back, everybody.